We fight back. That's right. All right, I'm going to pass it to our co-executive director, Ana Lilia Mejia, so we can get this rolling. You all ready? All right. What do we want? Medicaid. What do we want it?
Compas, brothers and sisters, how you doing? Hermanos, somos poquitos pero benditos. All right. So, y'all, we know the task at hand. We are all gathered today to not only rally amongst ourselves, but also to move our message before representatives who should put the concerns and the well-being of regular people before moneyed interest, before the next meme coin, before any connection to what is shaping up to be the largest transfer of wealth from the bottom 99% all the way up to the 1%. And we will not stand for it. Now, y'all, it's easy to imagine that the unscrupulous acts of not only this administration, forgive me, y'all, but its lackeys in Congress, present company excluded. Thank you. Thank you for the answer. It is easy for many in the United States to perhaps imagine that they are not going to be incredibly impacted by this large, unscrupulous, unconscionable transfer of wealth, by this ridiculous notion that because we all die, some of us, depending on our bank account, must die earlier without care, without concern. But every single one of us will be impacted, whether or not you're on Medicaid, whether or not you are hoping to be able to receive Medicare, whether or not you're healthy today. Every single one of us is going to be impacted because we will then be in a society in which the haves and have-nots, where the haves have many and have much, and the have-nots are denied food. The have-nots are denied health care, where the have-nots are denied education. And let me tell you, that's a society none of us want to live in. Is that right? Is that right? So, like many, I also have a Medicaid story, and I want to share for a moment, if you please. My mother, a hardworking woman from Colombia, who immigrated to these United States, fleeing persecution and violence, both economic and political, worked her whole life to the point where she literally destroyed her body to be able to provide food for my sister and I. My mother was diagnosed with dementia. And in order for me and my sister to be able to care for our beautiful, wonderful, hardworking mother, we needed to apply and navigate the Medicaid system. We, like many Americans, had to spend down the little assets that she had. Like many Americans, we did what we must to ensure that my mom had access to the kind of support that not only she needed, but y'all, 3 households would be unable to survive if my sister and I, instead of being able to rely on a daycare system paid for, thankfully, by Medicaid, if we couldn't rely on that, my mother would be unwell, my sister would be unwell, I would be unwell. And so when we think about the actions, the precipice in which we find ourselves, it's not just the impacted individual, like many of us are, but it is the entire community. Because we are all tethered to each other. Because like I said, a society in which some are denied health care, and where some are denied education, where some are denied housing, that is an unjust, untenable, and frankly, like disgusting, cruel nation. The last thing I'll say, and I'm going to hand it to you. I'm sorry, they gave me a mic. It's trouble. Last thing I'll say is that we should not be confused about what is happening in America and what it means. Many of us are still saying that authoritarianism and an autocracy and an unjust form of government is around the bend. But it's not true. All of that has already arrived for many of us. It is privilege that allows some of us to think it hasn't arrived. But as the daughter of a Colombian woman and a Dominican man that lives in this body and this brown skin, I now travel with my passport because I now live in a nation in which I do not have due process, in which I do not have equal protection, in which masked agents of who knows where can sweep me off the street without question, without my rights. And it doesn't matter that I was born in this nation, because what they are policing are our bodies. And so I'll end with, this is not the first time we have seen this type of authoritarian, unjust regime take over our nation's government. This is not the first time in which some of us are born not free, in which some of us, because of our skin, because of our heritage, are denied equal protection, due process, and the protections of our Constitution. I'll remind you that we used to call that system Jim Crow. And that is what has already arrived for black people, brown people, poor people, or people of good conscience that will raise their voice and decry this injustice. And so let's name it for what it is. And let's make them choose. Because what's before us is whether or not every member of the Senate and every member of the Congress, they are going to let us know whether or not they're on the side of a new Jim Crow, of continued anti-blackness and injustice, or if they're going to stand with humanity. And let's name it for what they are. Let's name them for what they are doing. Let's decry what it is. And then let's not stop here, y'all. Let's go home and deny them what they actually care about, which is the kind of position that enriches them at the expense of all of us. Now I'm going to let go of the mic, and I'm going to give it to even more fired up people. So I am so honored to first, I'm just going to hand, you see, Senator Wyden, you have a fan club. You have a fan club. Tell us what you're gonna do, how we stand together, and how we can fight back, not only now, but always. Senator Wyden.
Thank you, thank you. You know, that was such a powerful speech that you heard. I'm looking at that sign over there because your speaker said something about choices. Our choice is Medicaid over the parade. And here's what we're dealing with, folks. It's all of you wonderful people going to the grassroots, and we've always said that the political change doesn't start in the government buildings and trickle down. It comes bottoms up. And I'm looking around at all these buildings right adjoining where we are. Take a look. All of them have lobbyists. Insurance companies, private equity things, fast-talking lawyers. And I'm telling you, this is, as the speaker said, about choices. And when Congresswoman Dingell and I, give her a round of applause, she's a big champ from Michigan. When we swing into action, and y'all, I think, know I'm the point person for the Senate on Medicaid. I'm the senior Democrat on the Senate Finance Committee. I want you guys to know that this proposal is the biggest Medicaid cut in American history. And we will not rest until we block it. So the money is on the other side. It's in those offices, and they're not out here sweating like all of you, hoping you might get a glass of water and a chance to sit down for a minute. But I want you to know, you're my roots. I was director of the Gray Panthers, the senior citizens group. And when we got started, if a town had a lunch program for senior citizens, that was a big deal. And all of us worked together to try to get some health care justice for the disabled, for the seniors. Do you know that this bill that we're dealing with spends so much money on the affluent that it breaks the budget cap, and they want to cut Medicare? We're not going to let that happen because your grandparents deserve better. So this fight is going to be decided, in my view, over the next couple of weeks. And I'm sorry to ask you to give up a little time, a little effort walking, a little phone work, and table topping. You know, when you go from table to table, your buddy said, don't be shy. I've been accused of a lot of things. Being shy is not one of them. But I just want you to know, I went to school on a basketball scholarship. And after the game, my mother would say, dear, it's been so good to be here with the family. Make sure that when you guys go out, you're running with the right crowd. Well, let me tell you something. I'm looking at these signs. How damaging it'll be to have the cuts to health care. What happens when some folks get sick and others get red? Sign says, why shouldn't we be sympathetic? Not. But I want you to know, if my mother was here today, I'd say I've been to the rally. I've been with my friend Congresswoman Dingell. Heard a great speaker from Columbia. We're going to hear more speakers. But I would tell my mother, if she was here today, looking out at all of you, looking out at all the signs, I know for sure I'm running with the right crowd. God bless everybody. God bless.
Thank you. Our next speaker has been bringing the ruckus and the justice from Ann Arbor to Ypsilanti. And I want someone to tell my Detroiter husband that I actually got those right. I am so excited to introduce Representative Debbie Dingell, who is going to bring it not only here, but also in this fight.
Thank you. And to my great friend Ron Wyden, who I've known forever. He worked with my husband. We believe every person when they're sick should be able to go to the doctor and get the care they need. And Ron and I are never going to stop working together, and we are going to protect the working people in this country. So good morning to you. I'm actually in markup, and my staff said to me, you don't have time to do this. And I said, I will make the time because we have to save health care for every American. You know, it's exhausting to have to keep doing this. But we cannot be quiet. We will not let them silence them. I have an ultimate goal. When my husband died, I made a promise to him that I would get universal health care over the finish line. And I ain't dying for a long time because we got to get health care is a basic human right for every American. So this bill we passed in the House, I've been working on this since you know what this man would be when he became president, but I did not, I guess you just wanted to believe that he would not rip health care away from those that need it the most. And I've been working with my governor in Michigan. I'm working with people across the country. I mean, we have an independent group, not a Democratic group, an independent group that has said, that's a government agency that says the bill that passed the House of Representatives will rip health care away from 16 million Americans. If that bill becomes law, and I'll be damned if we're going to let it become law, people will die. People will die. And I don't care if some people are callous, you know. People are going to die at a young age. I never use my staff wishes I'd stay on script, but I've never met a script I liked. People are going to die. That's her, young people, little children. I was at the University of Michigan I have asthma, going to my asthma doctor, and before I ever got there, people kept stopping me, and a mother with a child in a wheelchair was on the elevator with me, and she just started sobbing, and said, "Make me a promise I'll still be able to bring my child to the doctor, that he'll get the health care he needs, that we can get the medicine that we need." How can we ever tell a mother of a child that she loves, that when their child needs help and support, they can't get the health care that they need? It's wrong. They gotta care. And Josh Hawley, a conservative United States Republican senator, I never thought that I would be dependent and praying for someone like him, calls what they're doing to Medicaid immoral. I've been going around and hearing so many stories. I have a family, 2 working people, both have health insurance, but they adopted, when he was a baby, 3 weeks old, a Down syndrome child. They love him. Oh, he makes me smile and makes me laugh. He runs around. My office is still recovering from his visit a couple of weeks ago. But if they lose their Medicaid, if they do what they want to do, they can't afford to take care of this child that they loved and adopted, and he's giving a great quality of life. I've gone to senior senators and met with seniors, and a woman came up to me and said, "My husband's in a nursing home. Do you all realize that Medicaid is the largest payer of long-term care in this country?" And a whole lot of people, I know you do, and that's why we're fighting to protect your Medicaid so you don't have to worry. Well, I'm fighting. We don't have what you need, okay? I'm also, separately from all of this, fighting so people can stay in their own home, in their own community, where people they love. So long term. But by the way, there's a waiting list of 1 million people, and it saves money. Saves money to have home care. We didn't get that one done either. But let's protect those right now with Medicaid and Medicare. And when the bill came from the House to the Senate, now they're talking about wanting to cut Medicare. You know what I say to all of them? Bullshit. You cannot hurt regular people. They don't, for what? So billionaires can get tax cuts? This woman she was just started, she said, "My husband's in a nursing home. He'd be thrown out on the street." Is that what we want to do in America? And to all these people who claim they're Christians, I want to quote Matthew to them. Matthew 25. "When I was sick, you took care of me. When I was hungry, you gave me something to eat. When I needed clothes, you gave me something to wear." As human beings who just care about each other, we must fight to ensure that every person has access to health care, and that Medicaid and Medicare are two of the programs that ensures those that need the helping hand and need it the most have it. And we won't let people tell lies about the program. We're going to tell them the truth, and we are going to protect those that need us to be the fighters for them. So, thank you for coming here, and it's great to see you here, and you got me out of committee, so I didn't have to listen to some whatever. But I need you to all go home. We got to win this at the grassroots level. We got to make sure you're organizing your communities, your elected officials understand. Put the human face on it and say to them, your job is to protect our community, not to screw it. Thank you very much.
I told y'all, from Ann Arbor to Ypsilanti to Washington, D.C. Thank you so much, Representative Dingo. All right, now I get to hand it to another amazing Congresswoman leader. And y'all, I want to share. Representative Jayapal isn't one of those representatives that you just get some like rubber stamped letter back when you share a concern or complaint. Representative Jayapal isn't the one that just sends you to a staffer and says, you know, write down your concerns. Someone will tell me about it later. This is an individual, forgive me. This is an individual who has dedicated their life to fighting on behalf of people before they even got to Congress. This is an individual who is so committed to our movement that they spend weekends training regular folks to be able to understand what is happening and to advocate and resist. And so I am so proud to be able to introduce a member of Congress who stands with all of us. Thank you, Representative Jayapal.
Thank you, Ana Lilia. Thank you, everybody, for being here to show that it is our people power that makes a difference. Our job is to show them that power doesn't flow from the top to the bottom. It flows from the bottom to the top. And so I am so proud to be here to say, hands off our Medicaid. Hands off our Medicaid. We know exactly why they are doing what they are doing, because they once again want to screw working people and poor people, all so that they can give trillions of dollars in tax breaks to the wealthiest. And listen, they're trying to do some ridiculous stuff right now, like say, yes, I mean, look, they're trying to do some ridiculous stuff like say that what they're doing is cutting waste, fraud, and abuse. No, what they are doing is kicking 16 million Americans off of health care. And what they have to understand is it is rural health clinics, it is pregnant women in their districts, it is nursing homes and seniors, it is rural hospitals, it is every single thing that people in every district across the country, red and blue and purple, are gonna lose. And the only people that are going to win are the billionaires who just were going to go buy another yacht. And we have to say, hands off. Hands off. You know, they keep talking about all the ways they're not going to cut Medicaid. I'm on the budget committee, and they kept saying, oh no, we're not cutting Medicaid. We're not going to cut Medicaid. And so I introduced an amendment that said, there will be no cuts to Medicaid. Guess how many Republicans voted for that amendment? You got it, sister. 0. And now they are cutting Medicaid, and they're literally out there lying about it. They are lying about it. And so the only way to fight lies is with our truth. The only way to fight hate is with our love. The only way to fight their power is with our organizing. And so that's what we have to do now, and ramp it up. Because they are not holding town halls. You know how many town halls I've held to my sister Ana Lilia's? since I came into office 8 years ago, we've had over 120 town halls, okay? Because guess what? You all elect us. It's not the other way around. We report to you, not the other way around. So keep showing up in these districts. Now it's in the Senate, which means it doesn't matter which district you live in. If you are in that state, that Republican senator should care about you and your votes. And that is the important thing for you to know, is that when you show up, it matters. It matters today, and it also matters tomorrow, because the more people we have that are pointing out the lies that they are spreading about the immigrants who are on these services, the more they do their raids, the more they continue to grab power, know that it is all in service to one goal. These are not disconnected fights. The raids on immigrants across this country, the taking, the disappearing, and the kidnapping of immigrants is directly tied to their attacks on Medicaid and Social Security. And we have to stand up and fight back on all of these things and point out that this is just an authoritarian power grab. And if we are going to fight authoritarians, then yes, we are going to do everything we can here in Congress, but we are also going to build the movement for all of us around the country to be in the streets to make sure that they are paying the price of stripping our democracy away from us. And so I'm really here just to say, they wrote a big speech for me, but I just, I felt like this was the important thing to say. We are not going to let our people be killed. Because Joni Ernst wants to say we're all going to die. Shame on her. Shame on her. Shame on the cruelty and the callousness of the kids and the seniors and the people across this country, because every day I'm in an airport, and because I'm on MSNBC quite a bit, I have people coming up to me and literally crying on my shoulder because they wouldn't be able to get health care without Medicaid. They are struggling to just put food on the table while these billionaires are just taking over the country and talking about people as if they don't matter. Well, let me tell you something. We matter. And we have power, and we are going to continue to build that power. We are going to protect Medicaid for everyone. We are going to make sure that we protect health care. We are going to make sure that our rural hospitals stay strong, that our seniors have the care they need in nursing homes, that our kids are able to get the care they need, that pregnant women, 60% of pregnant women in the state of Louisiana, Mike Johnson's home state, are on Medicaid. So my sister, let's take our tears, let's take our fears, let's turn it into power, let's organize and say to them one final time, say it with me, hands off! Hands off! Hands off! Hands off! Now people power! People power! Thank you, everybody. Let's get this done.
I love it. I love it. Thank you so much. I told y'all we got powerful, wonderful, incredible, conscionable friends. And we must take this fight everywhere. Oh my gosh. You know what? This is just rolling the powerful women in Congress, y'all. Now I get to introduce, you know what? I'm just going to call the Congresswoman my sister from another mister. I would say the most enlightening, the most calming presence, frankly, I have ever been in front of within Congress, I have to tell you. The most insightful, connected, conscionable member representing the great state of Massachusetts. Again, I will call him my sister from another mister. I want to introduce the incredible, the amazing, the bring the fire, tell them what's up, Congresswoman Ayanna Pressley. Give it up. Give it up. How are you? Oh, thank you. Thank you. Please.
All right. Hey, movement family. And we are truly one movement and one human family, and that's why you're all here when you could have been anywhere else. You chose to be here because you recognize that our freedoms and our destinies are tied. Thank you to our advocates and our partners in good. Thank you for being here today. Thank you for never losing sight of what is necessary in the work and the fight for our shared liberation and our collective humanity. You know, every day in Congress, I sit across the aisle from Republicans, and I have to ask myself, since it, all around us is callousness, contempt for every person that calls this country home, and I'm going to say cluelessness. We'll stick with that C theme there. Chaos, callousness, contempt, and cluelessness. Because I wonder if they've ever sat at the bedside of a loved one in their final days. I wonder if they ever rushed a toddler to the emergency room with a fever. These are basic human experiences: grief, worry, care, concern. So either my colleagues across the aisle are some sort of extreme anomaly, and they've never experienced these moments, or they simply don't give a damn. Maybe they believe if the language you speak is different or your bank account is lighter, your heart just doesn't break the same way. But you and I know that's not true. Again, we are part of one human family. Brother James Baldwin reminds us that the children are always ours, every single one of them, all over the globe. And I'm beginning to suspect that whoever is incapable of recognizing that may be incapable of morality, said Baldwin. Well, Medicaid is a lifeline to both our elders and our babies. It's NICU care, it's blood pressure medications, it's cancer treatment. There is no moment, in my view, more basic and human than trying to take care of and keep safe your loved ones. In America, far too often, for far too many, we come up short. But that is not on our caregivers. That is on a broken system. And in the midst of broken systems and broken promises, programs like SNAP, food stamps have been essential. The difference between a family going hungry or being able to stretch those groceries until payday. Being poor is not a character flaw. And being poor is one of the hardest, most expensive, one of the hardest jobs you'll ever have, and one of the most expensive conditions. Medicaid has been essential, providing essential care to those who need it most in the midst of a crisis or a chronic diagnosis. Republicans who gave their vote and their endorsement to this horrific, big, ugly bill should be ashamed. They voted against their neighbors. They voted against their constituents. They are complicit in wholesale harm. And these programs, as I said, they are essential. They are core to the basic functions of government. We're not talking about nice to haves. We're talking about programs that determine who lives, programs that determine who dies, programs that determine who survives, programs that determine who thrives. But this is not an inevitability. In this extremist march towards fascism, what history has taught us time and time again is that appeasement never works. Silence never works. What they want is a citizenry that is ignorant and uninformed. They want a citizenry that is indifferent to the suffering of their neighbors. They want a citizenry that is inactive. But in this moment today, we assemble, we come together to reject and resist the vision of Donald Trump's America. And let me just say, for those that think that you can inoculate yourself or you are exempt from this harm is coming for everyone. Your whiteness will not keep you safe. Your wealth will not keep you safe. This hurt and harm is coming for everybody. I just wish I had some colleagues that were more concerned with doing a job than keeping it. That's what has them complicit in this cult of cowards and wholesale harm, because of this culture of grievance and political retribution that the occupant of the Oval Office moves with. What happens in the weeks to come will determine the lives and livelihoods of families for decades to come. Look, y'all, movement family, this is not just about how do we get through the next 4 years. This moment is going to determine and shape the next 100. And the Senate must act accordingly and listen to the people and stop this bill in its tracks. The consequences could not be more severe. I'm appealing to people. This is bigger than Democrat and Republican. This is about right and wrong. This is about good and evil. I'm appealing to people of conscience to stand united against this bill, to raise your voice and share your stories. And to the Republicans who are all too eager to greenlight a handout to billionaires on the backs of the most vulnerable, if you won't act in good faith, at least act to save your own job, because we will not forget where you stand in this moment. The people deserve better, and we can stop this big, ugly bill. Listen, MAGA is a cult and it's a movement. But the only way to beat a movement is with a movement. And that's why we're here today in this heat, because we are going to match their energy. So movement family, I love you. We won't back down. 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 I love you, movement family.
Thank you. We won't go back and we won't back down. Y'all, now we're going to hear from, these are impacted real people. We know we must uplift our stories, our truth, and we have to fight for our government, for our nation, for our well-being. And honestly, not for nothing, we have to fight to restore the dignity and humanity of those who seek to oppress us. We are doing them a favor by reminding them that we are all human, even them. Even if they act with rampant inhumanity and unconcern. Now I want to introduce an impacted member, from a leader from Make the Road New York. Y'all, this is a sister. Esta es una hermana that provides health care in her profession as a home health aide, but will be denied health care because of this unscrupulous BS. Ahora es un placer introducir una hermana, una líder de Make the Road, que la ironía, compañeros, que esta compañera puede proveer cuidado médico y asistencia a los demás por medio de su trabajo como home health aide, pero por las acciones que van a ocurrir, se le va a negar cuidado médico a la compañera. ¿Cómo va a ser injusticia? Miriam, comparte tu historia.
Buenas tardes a todos los que estamos aquí. Sí se puede. Ok. Buenos días a todos y a todas que estamos presentes aquí. Mi nombre es Miriam y soy orgullosa miembro de Make the Road New York. Viajé desde Nueva York para estar aquí hoy y para luchar por Medicaid y otros programas esenciales en nuestra comunidad y para todos. Estoy enojada y con el corazón roto ante la amenaza de perder Medicaid en el país más rico del mundo. Solo para financiar más recortes de impuestos para los ricos. No podemos permitir que eso suceda.
I'm going to be interpreting for her. Good morning, everyone. My name is Miriam, and I'm a proud member of Make the Road New York. I traveled all the way from New York to be here today to fight for Medicaid and other essential programs. I'm angry and heartbroken at the threat of losing Medicaid in the richest country in the world. Just to fund more tax breaks for the rich. We can't let that happen.
Soy madre de 2 hijos y trabajo medio tiempo como Home Health Aide. A lo largo de los años, Medicaid ha sido crucial para mí. De hecho, hubo momentos en los que mi vida dependió del programa. Sin Medicaid, no había podido pagar el costo de 2 cesáreas que tuve al dar a luz a mis hijos, ni a la atención médica que necesité después. Medicaid también ayudó a mantener sano a mis hijos, ya que ellos también fueron beneficiarios del programa.
I am a mother of 2 and a part-time home health aide. Throughout the years, Medicaid has been crucial for me. In fact, there were instances where my life depended on it. Without Medicaid, I wouldn't have been able to afford the 2 C-sections I had when giving birth to my children, or the care I needed afterwards. Medicaid also helped keep my children healthy since they were also Medicaid recipients.
Hoy en día visito al médico con frecuencia para controlar mi salud. Necesito tratamientos regular para el asma y recientemente me diagnosticaron endometriosis, una enfermedad crónica y dolorosa que requiere seguimientos constantes, monitoreo y planeación de tratamiento. No sé lo que pasará el día de mañana, pero que sí sé que sin Medicaid, mi endometriosis y otras condiciones de salud podrían empeorar e incluso morir. Esto dejaría a mis hijos sin madre, ya que mi ingreso actual es muy limitado y Medicaid es una línea de vida que me ayuda a mantenerme saludable.
Today, I make frequent visits to the doctor to manage my health. I need regular asthma treatment, and most recently, I was diagnosed with endometriosis, a chronic and painful disease that requires frequent follow-ups, monitoring, and planning for treatment. I don't know what will tomorrow hold, but what I do know is that without Medicaid, my endometriosis and other health conditions could worsen and I could die. This would leave my children without their mother since my current income is extremely limited and Medicaid is the lifeline that keeps me healthy and alive.
Como Home Health Aide, que trabajo de cerca con personas mayores, veo como nuestros ancianos dependen de Medicaid y programas similares para sobrevivir. Necesitan atención médica constante. Necesitan Home Health Aide en el hogar para apoyarse en sus actividades diarias. Quitarles el Medicaid a ellos y a madres como yo sería devastador.
As a home health aide worker who works closely with elderly patients, our seniors rely on Medicaid and similar programs for survival. They need frequent medical care. They need home attendance for daily living. Stripping them and mothers like me of Medicaid would be devastating.
No se oye, digan. Qué vergüenza que nuestro gobierno intente quitarnos el acceso a la salud. Sin salud no hay vida. Debemos unirnos y luchar para proteger Medicaid, el plan esencial Medicaid. Sin estos programas, millones de personas como yo sufrirían y algunas morirían.
Shame on our government for trying to take our health care away from us. Without health, there is no life. We must come together and fight to protect Medicaid, the Essential Plan, Medicare, and the Affordable Care Act. Without these programs, millions of people like me will suffer and some will die. What do we want? When do we want it? What do we want? When do we want it? Gracias, Miriam.
Gracias. Gracias, Miriam. Thank you for your story. Y'all, les hablo a todos. Y'all, we are going to make the difference. We are going to be the agents of change. We are going to defend not only ourselves, our bodies, our communities, but y'all, we are going to be the agents of change to save democracy. Are you with me on this? Y'all, without regular people sharing their stories, everything can be lost. It is the courageous act of moving from a place of shame and individual pain and towards community, towards organizing, towards a collective power, a collective action, the loss of selfishness, and a step towards community and selflessness. And we have a leader who, alongside all of us, is ready, willing, and able to do what we must in order to save healthcare, in order to save our communities, in order to save our nation. I am so glad to introduce, he's the VP of Advocacy at Housing Works, Mr. Anthony Feliciano. Venga, compa. A usted.
All right, folks. My name is Anthony Feliciano. I'm VP for Advocacy, as you heard. But I want to make it very personal first. My mother, for the last 20-some years, has been living with lupus. I spent from my childhood to this day almost losing her at any moment. But you know what was one of her lifelines? Medicaid. That's right. Also, a public hospital that is necessary in our communities. I'll be very real. When we have a fascist, racism, every ism you can think of, the way they go after us is by taking what we deserve, what we fought for, what we need. And that is not only Medicaid, but several other things. We have an array of communities under attack. It is purposeful, it is deliberate, it is cruel. Our trans brothers and sisters, our people living with HIV, our people who use drugs, those who I think are discarded, are not going to be discarded. Are we going to let that happen? Our communities mean a lot to us, from a personal, from families, but we have an administration that's prepared to erase us, who has been doing it already. They did it globally, they're doing it domestically. Our immigrant brothers and sisters are under attack. Not one of us should say we're going to stand back and let that happen. In the HIV/AIDS movement, Medicaid is a lifeline. You don't end the epidemic without having Medicaid. We spend too long in our fights to allow this to continue to happen. We stand here because we understand what it means about caring for each other. But we need, while this is desperate times and we feel the sadness and the anger, we have hope. There's a saying, that hope has two sisters, anger and courage. The anger to stand up against what's going against us. The courage to continue the fight. We're going to have only our hope, but we have each other. There are few of them, there's more of us. And we're not going to allow for them to make the rich richer off our backs. We're not going to allow someone to continue dying in our communities. From Puerto Rico to D.C., we will fight. I am from Puerto Rico as well. I know what it is. I know what it is to have worker requirements in Georgia. And they now want to do it nationally. And I also know that every part of our public health infrastructure is under attack. And that's only to put money back in the pockets of the rich and make them more powerful. But our power is our people. Our power is our community. And while we stand here, we will go to everywhere we need to be to make our voices heard. I'll stand with you as well. Housing Works has been in every kind of rally and civil disobedience you can think of. Just the other day, we were against RFK Jr. with many other folks. But you need to understand, those four have hired and appointed people in office that also don't care about us. So just don't think it's just those four leaders. We need to clean up now. We need to heal. We need to use hope, and we need to fight back. Gracias.
Gracias. What do we do? Stand up, fight back. Y'all, I have someone who has been standing up, fighting back, not only on behalf of the disabled community, but as someone who knows firsthand the importance of not only preventive care, chronic care, but just human care. I am so proud to introduce a leader from Caring Across Generations, the incredible and powerful Nicole LeBlanc. Nicole, bring it. Thank you.
Greetings, everyone. It's great to be here on this beautiful day. Medicaid is an essential lifeline in the lives of adults with autism and other developmental disabilities. As someone who is with autism who is on both Medicare and Medicare, it is essential that Medicaid and Medicare be protected and not caught. Access to Medicaid for workers with disabilities is critical to meeting our unique health needs. Medicaid is one of the most cost-effective healthcare programs in the nation. On top of that, Medicaid is not just a healthcare program, it is a long-term care program. Access to HCBS plays a big part in improving health outcomes and reducing health disparities among adults with autism and other disabilities. Cuts to Medicaid would only worsen this problem of finding doctors who take Medicaid and worsening health outcomes among people with disabilities. Cutting Medicaid will lead to higher ER use, not less long term. It will also increase out-of-pocket medical costs, money that people like me don't have. Also, right now, it is already a constant struggle to find doctors who take both insurance. Cuts will only worsen this problem. A big fear many of us have, like in Maryland, is that cutting Medicaid will lead to the elimination of optional services like the new adult dental benefit. When I first moved until recently, Maryland did not have an adult dental benefit. This was a major challenge as someone who falls through the cracks and doesn't get HCBS and has been put through the ringer of the healthcare system since moving to the state. At the start of the pandemic, for instance, I had to have a wisdom tooth pulled due to an infection, followed by the 2 other wisdom tooth. And as a result of having no insurance, I had to use programs like donated dental to cover it. Trying to access free dental care is very hard for somebody who does not get HCBS and has no case management. Being disabled is a full-time job. Instead of cutting Medicaid, it would be more cost-effective to eliminate the institutional bias in Medicaid and make HCBS an entitlement for all adults with disabilities, especially those with autism who don't have intellectual disability and have poor adaptive functioning. Access to HCBS can reduce health disparities and keep people like me out of the ER. For instance, here in 2021, suffered severe COVID and it sent me to the ER twice. And I never had the typical symptoms that people normally have. And as a result, I developed numerous complications, gut, thyroid, PTSD, and I've been through the ringer of the healthcare system. We must also normalize access to telehealth for everyone on Medicaid. It allows us us to get care without having to travel. The time is now to expand HCBS, not cut it. You know, cutting HCBS will only worsen the direct care workforce. Staff turnover is traumatizing and destabilizing in the lives of people with disabilities. We need stability now more than ever. You know, people with disabilities like me deserve to thrive, not live in survival mode all the time. You know, in an ideal world, we need universal health care, universal long-term care, no asset limits, no earnings caps. A budget is a document of values. A nation is judged by how it treats its most vulnerable among us. Once again, do not balance the budget on the backs of the disability community. Our nation's most vulnerable are not disposable. Cutting Medicaid and this war on the disabled is eugenics, and it must stop now. Thank you for listening.
This gentleman, I don't think this gentleman needs an introduction. So I'm just going to hand it to the great gentleman and senator from the state of Vermont, Senator Bernie Sanders.
Thank you, Ana Lilia. Well, let me thank all of you for coming out in these kind of unprecedentedly difficult times. Together, we are fighting against oligarchy and a government of the billionaire class whose greed wants more and more wealth for the 1% and is turning their backs on working people. Together, we are fighting against authoritarianism. A president who wants more and more power, who has no clue what the Constitution of the United States is all about. And today, we are assembled because we are taking on the worst piece of legislation in the modern history of this country. At a time when the 1%, the richest people in this country, have never, ever had it so good. Does anybody think that billionaires need more tax breaks? And in order to pay for the tax breaks for the billionaires and the large corporations, they're going to war against low-income and working-class people. We are the only major country not to guarantee health care to all. The health care system is broken. They want to make it even worse by throwing 16 million people off of the health care that they have. And let's be clear, a study came out last week from Yale University of Pennsylvania. If you throw 16 million low-income and working-class people off of health care, if you cut back on what nursing homes